Good evening to everyone and welcome to today's session. I don't know that we are this popular. If we know that we are this popular, we would have organized it in Usmania Medical College gallery or maybe in a little bigger venue. Yeah. The exam of AIIMS is definitely very popular, and the state MD entrance is also following the trend and pattern of AIIMS. 50-60 image based questions, case study based questions, and that makes the process like attending an OPD, a busy OPD in a government hospital, rather than really a suffering of writing an entrance. That kind of experience these clinical question based exams are giving us today. So how many of you have actually attended the AIIMS exam? Raise the hand, doctor, to get a idea. Oh, very good number. Don't be angry with me if you don't find exact verbatim of what was asked. You know that it is all recall questions. There can be errors of commission and omission in the frame of the question. Can you ask for some water, please? Water. So, doctor, let's make the great beginning. In fact, as a teacher, I'll be waiting for this November AIIMS, because every week we conduct from now onwards 2 mock tests, Wednesday and Sunday. Full scale grant tests. So while framing the questions, we try to do as much as possible the question frames to be closer to what it is actually asked in the exam. So lot of our students have messaged me after writing exam. So in all those images, how do you know that these are the same images which are going to come? Because in our mock test also we have a similar image based questions. It's no big deal. A sandfly looks like a sandfly, whether we conduct it in a mock test or whether AIIMS frames it in the question paper. And the blister packet of leprosy looks like a leprosy packet only, whoever sets the question. So no big deal, right? So now let's make the great beginning. Hyperextension and flexion of 4th and 5th MCP and PIP typically is called as clawing, other name for clawing, which is typically seen in the case of ulnar nerve injury, is what you have to basically remember. Water. Now, otic ganglion. Now tell me, doctor, is this ulnar nerve question tough? No. If you cannot answer this question also, you are ready for the next November AIIMS. So easy. Definitely once more when you go for PGI, one question will be there on ulnar, median, one of the brachial plex nerves. Now, otic ganglion, what is except about it? Basically, if you look at the otic ganglion, laterally there is the trunk of the mandibular nerve, and medially there is tensor valley palatini. Posteriorly there is a middle meningeal artery. So this is the typical combination which you need to remember when it comes to otic ganglion. So where is tensor valley palatini related? It is related medially. So examiner simply asked, is it medial or lateral? But this is a dirty question. I don't think it is that easy a question. If you answered wrong, no regrets. Otic ganglion, what is the parasympathetic nerve supply that it supplies? Such beautiful questions are there. Suddenly relations means how many relations you will remember? Now doctor. So this is the typical otic ganglion. You can see relation of tensor valley palatini and how it is related to the mandibular nerve, etc., etc. Okay. Now, what was the question asked? Craniovertebral anomalies or junction? Junction, right? So basically the basio-occiput, atlas and axis, they constitute what is called as a cranio-vertebral junction. Not difficult question. Who will think that cranio-occipital junction, wing of sphenoid will come? Framing करने में भी थोड़ा मसाला add करना चाहिए. Some other structure nearby is added, it is more, it become little difficult. Now, what are the structures that pierce the buccinator muscle is a very important question. I am very happy to see 128 online viewers. After a long time we crossed a century score. Neelu, Manoj, Surya Prabha, Hyderabad, Rupam, Guntur and across the country. And I like to thank some of the doctors, Dr. Venkat, Dr. Nissi and many more who have written the questions and then scanned and sent it within hours after the exam. So buccinator is pierced by. If you look at the buccal branch of the facial nerve, it supplies the buccinator. It does not pierce, is what you have to basically remember. Whereas all the remaining structures basically pierce. Parotid duct, mucous gland of the buccopharyngeal fascia, lingual branch of the mandibular nerve, etc., etc. So a cut section of the thorax has been given and you are asked to identify the presence of the vagus which is there in the carotid sheath. A cut section has been given and a vagus is the structure which was asked to be identified in the carotid sheath is what you have to basically remember. Now what is the sensory supply of the ear lobule is a very, very important question. Ear is a very peculiar structure. We love to listen other secrets dearly and we don't want our secrets to be heard by anybody. So doctor, this part of the lobule, this is called the ear lobule, greater auricular nerve. You have a lesser occipital nerve, then you have a auricular branch of the vagus, then you have a auricular temporal nerve. This is how the typical ear lobule supply, ear supply is basically. So great auricular nerve is the one which is, do you call this one as lobule or that one as lobule? This only, no? What is biteable is lobule, right? Then what is the development of diaphragm? One of the easiest questions in embryology you can expect. Lot of time embryology questions we won't even know the terminology also, right? When is that point where proctodium meets stomodium on which week? You can actually expect such depthy questions in the exam hall, but examiner is little easy on you. So doctor, you have a pleuroperitoneal fold, septum transversum and some part coming from the body wall, septum transversum and pleuroperitoneal fold. What were there? Answer is A, not C. Pleuropericardium is not contributory, but pleuroperitoneum, body wall and septum are the ones which are basically supplying. Was it anal canal blood supply was asked or rectum blood supply was asked? What was the question asked? Anal canal. They can't ask like that. Why? Because if you look at anal canal, I'll come to both of them. You have a superior rectal artery, middle rectal artery, median sacral artery, which are the three arteries which are supplying the rectum. Whereas you have a superior rectal artery and the inferior rectal artery, which are the ones which are supplying anal canal. So if only two arteries supply, how can a four optioned MCQ can be framed? So I think rectum would have been asked. And then what is the third artery? Where is the third artery other than superior rectal and inferior rectal? Median sacral is the one which is basically predominantly supplying, actually anorectal blood supply is what surgery textbooks describe. So that is the reason somewhere it is falling in that grey area. So I leave it for you, but anyway, you know what is the question going to be asked. So what is the secret? one blood supply is definitely going to come. One of the branches of the aorta or one of the circle of Willis branches, one or the other question is going to be a definite question in the every entrance exam. Okay. Now, what are all the bones which are articulating with maxilla? I know some of you might have checked it in exam hall quickly, right? Yeah. That is the reason you don't need preparation for entrance exams. Some questions can even be checked. Now tell me, what the sphenoid is there among the options? Frontal is there. Frontal is there. Frontal is much higher than, okay. Actually mandible doesn't attach. Mandible doesn't attach. Sphenoid, in few people it attaches. So that is the reason frontal, if it is there, that could be the comfortable answer without any enigma. Neonate is saying, neonate is the name. Sphenoid is also given, is saying, is it given? No, yeah. Sphenoid is not given. So, nasal zygomatic lacrimal inferior nasal palatine vomer and adjacent fused maxilla. They are all the ones which are attached, and sometimes lateral pterygoid plate of the sphenoid is also attached. Mandible is not attached. Frontal is not attached, is what you have to appreciate. So this is how the attachments of maxilla are. So what are all the scenarios where axillary nerve is injured, doctor? Crutch palsy is the name given for radial nerve, not for axillary. Whereas in surgical neck of humerus, dislocation of shoulder, or if you give an intramuscular injection wrongly, it can end up in axillary nerve injury. All of you know very well. And what does axillary nerve cutaneous supply is? Regimental band area on the skin overlying the deltoid is the classical area where cutaneous supply. And what is the main function of axillary? Typically abduction is the one, the deltoid supplied by the axillary. Now what is that muscle which will lead to protrusion of the mandible? So you must know the various functions. Protrusion is by the lateral pterygoid assisted by medial pterygoid. Retraction is by the temporalis, deep part of masseter, geniohyoid and digastric. And elevation is by temporalis, masseter and medial pterygoid. I leave the literature for you. So if you look at historically, so many times this question was asked about medial pterygoid and lateral pterygoid. If you are not very sure about masseter, buccinator, medial pterygoid, lateral pterygoid, levator palpebrae superioris, they are the few muscles which you need to be very sure about the nerve supply. Okay. Now doctor, a illustration was given and trochlear nerve was given, and a trochlear supplying the superior oblique was given, and you are asked, put your finger on the trochlear nerve and identify it. Oh, no big deal, right? Was it the same? Brainstem was given. Dorsal aspect of the brainstem is given, so the only nerve which is emerging from the dorsal aspect. That is also a possibility. But what is the rule? Cranial nerves, one question on cranial nerves. Without that there is no question paper. That is the deal. Okay, as a part of the deal this was delivered. Okay, and without a question on brachial plexus, no anatomy. Ulnar nerve and axillary nerve have been delivered, right? So that is how we need to approach. So what is the nerve supply of the prunet arteries? Basically, so the prunet arteries is supplied by the median nerve, is what you need to remember. What is the nerve supply of the supinator? Supinator muscle? Radial. What is the nerve supply of biceps brachii? Musculocutaneous. So you must have all these important nerve supplies in your tip. This was one old question. Prunet arteries syndrome was given. You mean to say that was a compression of a nerve in the pruneata teres? Pruneata teres syndrome, maybe the median nerve if injured, pruneata teres get affected, that's called syndrome. Right or wrong? Okay, any alternative thought process of answer? You are thinking median or anything else? Even some of the students have written it as a pruneata teres syndrome. I was thinking syndrome or muscle, I am not sure. I am like King Dhritarashtra. Vidura will be telling that battle happened like this, like that, this many warriors are dead, so many students are excelling. Oh, is it like that? Very good. How is Duryodhan? Is he living? Could he answer about claw hand question? No, the king, he answered it as radial nerve, Duryodhan. Somebody will tell, some student will tell, then I will be thinking, I could not make my students at least get ready for common questions. You should not do common mistakes, you can do uncommon mistakes. So I think it is the examiner's ultimate intention is to get you to median nerve, I hope so. Now this is a very routine question, doctor. Laparoscopic inguinal surgery. Typically there is an area which is called as the triangle of doom, and there is another area, it is also called triangle of pain. This is the area which is supplied by lateral femoral cutaneous, femoral nerve and genitofemoral nerve. So typically at the time of inguinal surgery, if you happen, there is a chance of any of these three can get injured, and that can lead to development of excruciating pain. So that is the reason lateral femoral cutaneous nerve is the one which is commonly injured in the inguinal hernia. Laparoscopic surgery is what you have to basically remember. Meralgia paresthetica, that excruciating pain along the lateral aspect of the thigh and the hips. Was this question there? Two questions on lateral cutaneous, right? So it is also a very standard question which is expected to come. So what is the renal dosage of dopamine? Instead of asking that they have given dopamine at 3 to 5, what is it going to do? So what is your answer? Typically it will increase the renal blood flow when you happen to administer between 1 to 5 microgram per kg per minute at a low dosage of dopamine, which we often keep in the patients who are in shock, is what you have to basically remember. Now there was a question on osteoblast. Please correct me on some of the options here. Bone morphogenetic protein is there or not? So anyway, it is the one which controls, no doubt. Contains actin. Myosin was also there. Actually actin is definitely there. Myosin I could not get time to check. Then plasma membrane has dendrites or no dendrites. Was it an option? It has dendrites actually. So no dendrites become a correct answer for the except based question. Yeah? Not was not there in the options. Then that cannot be the answer if the except is there. Right? But anyway, some question on osteoblast. Actually, ideally we should call osteocyte. Osteocyte will have dendrites. By the time it becomes blast, the number of dendritic projections will actually decrease. That's funda. I don't know what was there in the this is how a osteocyte, it will have dendritic projections which will in the cell membrane. That's the point. What about? That's what myosin. I have gone from San Francisco to Suryapet to check on the Google. Is the myosin is also there or not? But actin is there. That is there in the Google. So then that should be the wrong answer. Somewhere like that. But let me tell you, this question won't repeat once more. This is not a repeater. These are all the innovative questions to trickle your brain. Little make you uncomfortable in the exam hall. But if you are feeling uncomfortable for a claw hand question also, then you can never be comfortable unless you go to reading room for another 6 months. So be sure. Then doctor, atrial natriuretic peptide, what it will do? As the name only says, natriuresis. How will it do natriuresis? It will decrease the sodium reabsorption. Where does it decrease sodium reabsorption? Two locations. One is proximal convoluted tubule and other is medullary collecting duct. In both the locations, it will decrease the sodium reabsorption. And it won't cause any mesangial constriction. So the remaining functions are all there. I leave the literature for you to review that very clearly on the functions of atrial natriuretic peptide. I am extremely sorry you are unable to see, but there is not much to see also actually. If we can communicate, debate, that's more than enough, right? And sodium iodide transporter. All of us know it is there in thyroid, but we need to know that it is not there in pituitary, but it is also there in placenta, ovary, mammary glands, kidney, gastric mucosa, entire world it is there except pituitary. This is an interesting question. Interstitial fluid volume calculation, what are the things that you will use? If you go through the high yield topic list I have given to you in the physiology, I think most of you have that 625 high yield topics. If you don't have, they will give you the, please collect the booklet. What are the 625 topics you should finish in 300 hours and not read more than that and go for exam and crack 80% score. So that is the idea. Definitely every time one question they ask on ICF, ECF, etc. How will you calculate interstitial fluid volume? So basically, extracellular fluid volume. Out of the total body water, how much will be our ECF volume? 60% is ECF volume. If we are a 70 kg individual, we are like a 70 kg water tank. Out of this, how much water is there outside cells? 60% of 70 liters is 42 liters of water is outside. Minus the plasma volume will give you interstitial fluid volume. So what substance you will use to calculate extracellular fluid volume? We basically use the radioactive sodium to calculate the extracellular fluid volume. From that you have to subtract the plasma volume. How will you calculate plasma volume? You will use the radio labeled albumin, because albumin is a predominant protein inside the plasma. So you use these two in order to indirectly derive interstitial fluid volume is what you have to basically remember. Okay. So that is the reason. What is the answer? Radioactive sodium and radio labeled albumin are the two important substances which you need to basically remember. Now which is called oh very good. We crossed 150 online viewers. So this broadcasting is the same thing which is used for broadcasting, same technology for broadcasting football matches. So it can sustain up to 1 lakh audience, but 152 is too small a number. I like to see how many will join. That means today evening we prevented 153 people traveling in hectic traffic and reaching this place, right? But still around 100 of you could be able to travel. Okay. So doctor, there are some areas in our body, in our embryonic life, they are not exposed to our immune system. Our immune system, thymus, everything will be presented. See, this is Ramus kidney. This is the Ramus what? Skin. So don't react because you are Ramus thymus. That is being educated. Thymus is educated in the embryonic life. But there are some tissues whose antigens are not exposed. So such tissues are called immune privileged locations. In embryonic life, our brain will not be brought and told that, see, this is Ramu's brain. That's the reason, by chance, if the brain gets slightly exposed to our serum, immediately our body will produce antibodies against our own brain. So don't prepare too severely for entrance that your brain get exposed to your own immune system. Right? So what are those immune privileged sites is the important question. Typically the eyes, the placenta in the fetus and the testicles and the neural tissue, they are not exposed to the immune, self-immune system. That's the reason they are called immune privileged. Long back our inorganic chemistry class, we were taught about Nernst equation. That is the reason we did not study it in physiology. Once more asking you to take the pen logarithms calculation and all that is a little tough job only. Okay, what is the Nernst equation? If you want to calculate resting membrane potential, minus 61 into logarithm of the inside concentration by outside concentration, 61 by Z. Z is valency of the ion. Potassium is monovalent or divalent? Monovalent. That's the reason minus 61 by Z is, Z value is 1. So minus 61 into logarithm of inside concentration is how much? Inside concentration is 100, outside concentration is 10. 100 by 10 is equal to how much? 10. So what is logarithm of 10? 1. So 1 into minus 61 is minus 61. So answer should be how much? Minus 61, which is nearest is minus 60. Is what you have to basically understand. Now doctor, pilocarpine has the same action. What is the action of pilocarpine? It's a meiotic. If you take cocaine, epinephrine or amphetamine, these three are what? Mydriatics. So which is the drug in this, which is the only other meiotic is the examiner's innocent question. Timolol is meiotic. If you know that also, examiner want to make you, please come and take MS ophthalmology, he will tell you. Right? Do you think AIIMS is tough exam? No. If you know pilocarpine is meiotic, timolol is meiotic, you are in. Right, doctor? If you are prepared well, exam looks easy. If you are not prepared well, every question look like an enigma. It is you who is reacting to the exam. So be very sure. Right? So then doctor, keyhole field defect. अरे ये क्वेश्चन में बहुत लोग they put their foot in mouth. Yeah. Keyhole shaped field. Field is good. If field is not, then I am more worried. Field defect. Okay, if it is keyhole field, that means what field it is? Visual field. Normal visual field is not keyhole. Hence, a keyhole must be a visual field defect only, unless otherwise examiner don't tell also. Right now? Chalo. What is keyhole defect? You know ring scotoma? What is ring scotoma in retinitis pigmentosa? Entire peripheral visual field become constricted and ultimately what is left is a small key through which you are peeping into the bathroom. Right? So that is how you are looking at the world. Right? So whose lesion led to that ring scotoma and make the patient look only the ring? Only ring like central vision left over. Retinal pathology. So retinal pathology or a optic nerve pathology is known to lead to development of a vision which is like a small keyhole. But while lot of students are confused about occipital lobe, last week only we discussed while discussing the AIIMS, DNB question paper. Every Monday and Wednesday we discuss the last 15 years of DNB questions, right? So one question definitely on one of the visual field defects, homonymous hemianopia, macular sparing, where will you find quadrant anopsia, where will you find superior and inferior, where will you find superior quadrant anopsia? Temporal or parietal lobe? Temporal lobe. Inferior quadrant anopsia? Parietal lobe. Next to PGI entrance discussion आप आते ना, कब है entrance? Next Sunday? हाँ? 15th. थोड़ा बीच में time दिया to take a little breath and accept, because रो के hiccups आते ना एम्स के बाद वो hiccups पूरा clear होके next you will go for PGI. Once more PGI guy will also make you cry. 2 options, 3 options, select everything. Right? So, okay, why people got confused is, whenever you are having a occipital lobe lesion, typically you get a homonymous heminopia, but there will be a macular sparing. So, the macular area of the visual field is spared. Why it will happen whenever there is a occipital cortical lesion? Typically in the occipital cortex blood supply will be there, no? God has given a beautiful thing in our visual mapping in the brain. What did he do? Any part of our vision can go, but not the central vision. That's what the God thought. That's the reason blood supply is created from many collaterals to the central part of vision in the occipital lobe. So if one vessel happen to occlude posterior cerebral artery, you get only peripheral field lost, but the macular part of the field will not be lost, because it will have multiple collaterals. 2-3 blood vessels will supply in the occipital cortex. That's the reason macular sparing homonymous heminopia is a feature of occipital lobe lesion, and they combined the two and thought that it is the keyhole. No, that is not the keyhole. There is a keyhole in each eye. What is meant by keyhole visual field defect? There is a keyhole in this side, this side. Both the eyes is having keyhole. Only patient could see from that keyhole. Whereas occipital lobe lesion, half the visual field is gone and it has got a small macular sparing part on both the sides. That is the difference which you need to appreciate. Yes. Yeah. So got it? So where do you find it? Whenever there is an optic disc coloboma, that is a classical lesion where you have the keyhole lesion, is what you have to basically remember. Now doctor, convergent squint, where do you find? Whenever abscess is paralytic, then typically both the eyes will come medially, and that is called convergent squint. No big deal. Not at all tough question. What was a tougher question we are expecting in exam? Primary deviation more than secondary deviation, where it is? Concomitant amblyopia, exenopsia, what is the age at which you will correct the amblyopia, blah blah blah. They are all the questions we were expecting, but the examiner left you very easily. But don't worry, strabismus is one topic in ophthalmology. In the top 20 topics, 100% you should be sure. If there is a superior oblique palsy, how will the head will be twisted, how will the chin will be raised, all those things you must be ready before you go to exam hall. You can never be innocent, because definitely one question is asked. Contraction of visual field, which anticonvulsant? Vigabatrin is the one which you need to remember. Then what is the histopathological appearance was a question. This we have asked many times in our mock test, which this image based question. These are the typical schwannomas, Anthony B bodies, which were given in the exam hall. Patient has intussusception, a polyp is being found, histopathology was done. Obviously, in an adult, what is the cause of intussusception? Hamartomatous polyp leads to intussusception. So examiner is exactly looking at that hematomatous polyp as an answer in a case of intussusception. But how much experts we became in preparation for entrance? We don't need to even look at the image. If intussusception is given, we are looking, our eyes are immediately looking for where is my hematoma, right? So that is the reason, honestly, you don't require at all is what you need to remember. 17-year-old, bilateral cervical lymphadenopathy, and there is a owl-eyed body. Classically, is an example of a Reed-Steinberg cell. In ALL, what is the deal before we went to exam? One question: without leukemia, lymphoma, no paper. Most common in pediatric age group is ALL. Overall, what is most benign among the leukemias? CLL. And you need to be happy because examiner even didn't ask about CD numbers. But you are all ready with the CD numbers, right? What is the CD number of hairy cell leukemia? What is the CD number of including Letterer Suvi disease? CD number also, you must be ready if you want to be in the top 100 ranks. So doctor, what is your answer? Shoot. I will give the authentic answer, but you give your answer. Hyperdiploidy is there, and even response to therapy is also a prognostic factor. How do you know hyperdiploidy is more important? Actually, most of the studies have proven currently early response to therapy determined by minimal residual disease at the end of induction is considered to be the most important prognostic factor. So, hyperdiploidy also is an important prognostic factor, but most important would be response to therapy is what you have to basically remember. So many times we discussed in the recent pathology discussion of the DNB question bank, we were discussing about definitely one question will come on prognostic factors of ALL. Morning only you should wake up and run through this list of is it T1221, is it 921 or 922, all those numericals of this table. This is one table we have to clean and go to the exam, right doctor? Now, actually question was given, what is the purpose of phase 1 trial? Don't be angry on me. Suddenly, actually 48 hours is little too short, but luckily nowadays with all WhatsApp and all, recalling question paper is no time. So what is the purpose of each of these phases? Phase 0 is for pharmacodynamics and pharmacokinetics. Phase 1 is for dose ranging. Phase 2 is for safety, efficacy, even phase 3 also. And phase 4 is for post-marketing surveillance. So is the phase 1 given or phase 2 was given? 1 was given. If phase 1 was given, that should be for dose ranging. Phase 2 is for efficacy and safety. But the dose ranging was given or not? Dose was given. Dose is there, no? That becomes the answer then. If it is phase 1. Okay? What is the function of etanercept? Favorite question of examiner, many times asked. It basically inhibits the TNF, tumor necrosis factor. Then, if there is an overdose of tricyclic antidepressant, remember doctor, barbiturate toxicity, benzodiazepine toxicity, salicylate intoxication, tricyclic antidepressant and amphetamines intoxication. A punch intoxications and organophosphor poisoning. Without one question out of the 6 intoxications, there will be no question paper. Definitely they will ask everything. Will you give forced acidification or alkaline diuresis or acidic or acidification of urine? What will you do? Which are dialysable, which are not dialysable, everything you must know. Now tell me doctor, can you dialyze the tricyclic antidepressants? You cannot. Why? Because tricyclic antidepressants are highly protein bound. Something which is very protein bound, you can't filter it on a dialysis membrane. That's the reason it is difficult to remove the tricyclic antidepressants on hemodialysis, and that becomes an except. Except is there or not? What should we do? If that is the case, then gastro lavage can be done. Sodium bicarbonate can be given. Huh? What is the first thing to do was there? Best thing to do. Okay, this English is very difficult language. Right. So somebody may say that I mildly will marry you, I severely marry you. So what is gold standard, what is investigation of choice, all these are very dramatic terminology. Huh? But anyway, doctor, this is the story of tricyclic. Hemodialysis cannot be done. That's a point to carry home. Now, what is a fibrinolytic agent? Was there fibrinolytic agent or fibrinolytic agent rescue? Was PTCI was there? Percutaneous transluminal. Then what is the question? You mean antidote for fibrinolytic? Antidote for the fibrinolytic therapy. Suppose if you give fibrinolytic, you want a fibrin promoting drug. Amino epsilon caproic, then that is the only anti-fibrinolytic agent that we ever know. So maybe that is the way of framing of question. But what is the carry home message? In the pharmacology, one question on antiplatelets, thrombolytics, anticoagulants, heparin, newer forms of heparin, direct thrombin inhibitors, all these things we have to smoothen and go to the exam hall. How does aspirin act, clopidogrel act, etc., etc. Okay. Even in the state MD entrance also, that is the favorite topic, right? From December 1st week onwards, we will be starting the last 20 years of APPG questions, topic wise classified and priority wise organized and reviewed. One day one subject. So Monday and Thursday every week, morning 9 to 6 we will finish. So please do come, and in about 8 weeks we will finish the last 20 years of APPG question bank. And already DNB question bank of last 15 years is available as an online video library. But let me tell you, DNB question bank is the mother of all question banks. So if you review and know what are the priority topics in that they are going to be the priority topics for other entrances exams also actually. So that is the point. So doctor, this is the story. I think a little change in the frame of question. After fatty food, what are the 4 drugs which are known to, whose absorption is known to increase? Basically albendazole, itraconazole, mebendazole and greasophulvin. So all the zoles and fulvins, greasophulvin is the one, if you eat along with a fatty food, paradise biryani, then it is gonna increase its absorption. Then another important thing is carbohydrates. Do you know they reduce the absorption of isonic acid, a very, very common and ATT that we give to the patients. Then which anti-HIV drugs should be given on empty stomach? Diadenosine, indenavir, zolcitabine and zidovudine are the 4 among the antiretrovirals. Empty stomach you need to basically administer. Now which is given orally in the management of hepatitis C? So we have ledipasvir, sofosbuvir, 90 milligram by 400 milligram combination we will get. Ledipasvir is given orally in the hepatitis C is what need to be remembered. Okay. Anyone answered lamivudine? Was there in the option? Lamivudine also given orally, but hepatitis B or C? Huh? B or C? Definitely not C. If that is C, then why will it be there? Huh? Okay. Ulipristal acetate. What is that? It is also called as ELA. What is the question? This question is not there. Huh? Oh, Uniprestal was given among the emergency contraception question. Oh, not used in that desogestrel wala question. Okay. Anyway, I told you no. Some students will go into hallucination. Some students will go into denial. Suddenly, if your score is not even crossing 100, you will start imagining some questions that you know correct answers. And at least will be happy that they are the ones which are being given. And think that you ask anybody after coming exam hall, even during our days also. बाहर निकलते ही कुछ लोग बोलते हैं 180 definitely, 10-20 here and there. We don't know 10-20 that side or this side. Okay, so on the other side we will find some of the friends coming out of exam hall saying 10 to 20 definite, 180 here and there, right? So after I got second rank and joined in MD General Medicine, I was thinking that am I losing the pleasure of exams and MCQs? No. Last 15 years I didn't lose the pleasure because of thanks to all of you. So what is the treatment of choice of bird flu? Acyclovir was not there. Except is not there. Okay, then we need to decide between two things. Oseltamivir is there, no? Tamiflu. Right? Tamiflu is the one which is preferred, but even Zanamivir and Peramivir are also suggested, but Tamiflu is commonly available. Now doctor, steroid is not used in the treatment of. Is there any difference in the options? What are the options? None of them are there. But anyway, multiple sclerosis is there. Yes or no? Multiple myeloma is there. Oh, difficult thing. Wilson was there? Yeah. But generally, when will you suspect Wilson's disease in a case of a child? A child is diagnosed by somebody because he has got jaundice, that possibly this is autoimmune hepatitis and he was given steroid therapy. Normally, if it is really autoimmune hepatitis only, then the response will be excellent. But the response is not there. So, a case of autoimmune hepatitis where steroid responsiveness is not there, that is a clinical scenario where you should think, oh, this is not responding, means this is not autoimmune hepatitis. It should be something else. And what is that something else? Wilson's disease. So that means will you use steroid or not? If it doesn't respond to steroid autoimmune hepatitis, you will think of Wilson clinically. But still, even in Wilson also there is an indication for steroid. Unfortunately, medicine is a paradoxical science. So, I think options being not very clear, we will skip it for brevity. How do you take biphosphonates? Pharmacology may examiner is interested on tomorrow after joining MD, do you know how to give prescription? Common question asked by patients is what? खाने के बाद या खाने के पहले? You will tell that. Then they will say, कितने बार खाने तो अच्छा होता? That also you will answer. खाने में क्या खाए तो अच्छा होता? Then comes the last drop of your adrenaline, right? So examiner also very clear. Whenever you give biphosphonates, what is the standard instruction? Ask the patient to take it on empty stomach with a glass of water. Then what will patient will say? If we take a glass of water, how will it be empty stomach? Right? So be prepared for the second question also. Lot of times patients will ask you, मतलब टैबलेट पहला लेके बाद में पानी ले लो, What do you think, doctor? You think that MD means, oh, you are in a star hospital and you'll have 10 assistants, etc., etc. No, doctor. एक छोटा रूम होता है MD के बाद, और रूम में एक फैन, सीलिंग फैन रहता, और patient after patient will come and they will pay 200 rupees and what will they say? इतना कमर्शियल हो गया डॉक्टर्स आजकल, है? कितना पैसे लूट रहे हैं लोग. Outside your Maruti 800 will be there and they consider that they don't even consider that 30 years you took to become almost your head is balding, prostate is showing few hyperplastic, not a dysplastic changes, but still इतना मेहनत करके MD बना बोल के वही they won't have courtesy. They'll say 150 looting, oh my god, just holding my pulse and 150 rupees. So you must be sure to instruct them properly. Now, linezolid, how does it basically act, doctor? Linezolid is the one which inhibits the initiation step of the protein synthesis. mRNA is studied, tRNA brings amino acid, and rRNA is the place where protein produces no. Initiation is the one which is inhibited by the linezolid. It won't affect the DNA or anything. Fluoroquinolones inhibit DNA gyrase. That's the reason they are nucleic acid inhibitors. Bedaquiline, what were the other options? Did they give isoniazid, rifampicin, ethambutol? Huh? So most of the drugs that you know are definitely not newer drugs. The one which you didn't know is the newer drug. Simple common sense है ना, इसके लिए पढ़ने की जरूरत है क्या? So don't ask me how many hours to read. Common sense. 52 images है, आपके कंट्रोल में है क्या? नहीं है. अगर आप पेशेंट्स को रेगुलरली देख रहे हैं, थोड़ा हाई यील्ड टॉपिक्स क्या है मालूम है तो आंसर करना इजी हो जाता है. Bedaquiline. So fundamentally it affects the proton pump for the ATP synthase. Probably mechanism of action of bedaquiline can be a question in the next PGI exam. So that is the reason you need to know it. You take the last 15 years of AIMS PGI doctor, शराब वाला क्वेश्चन नहीं है तो पूछो मुझे. दुनिया वालों माफ करना, हम नशे में हैं. Definitely one question will come on alcohol detoxification, right? If it doesn't come, you will have one benzodiazepine poisoning management, or if it doesn't come, you will have one question on the opioid intoxication. Definitely one substance abuse will be there. Flumazenil is used for benzodiazepine antagonism, is an easy question. What is it? Medical practitioner prescribed drugs are called which category? Category H. Aspirin, how does it act? It inhibits the thromboxane A2 synthesis. Primaquine is contraindicated in? Infants was also given. This question was not there. No, that there is a different question on malaria 2013 recommendation. It is a part of that question. This question is not there, no? This is there, that is also there. One or two? This is the part of that. Okay. That's the reason. Okay. Why you don't give primaquine in infants? The main contraindication for primaquine is G6PD deficiency. Why you don't give in pregnancy is, मैं बता रहा हूं आपको. Not that primaquine will go and create some craniofacial malformations or some teratogenic activity. You have no means of checking whether the fetus is G6PD deficient or a efficient fetus. That is the reason we don't give in pregnancy, right? And definitely it is, it can be given, but still it is not according to recommendations in infants. So both the things. Okay, that's a different question. Okay, two questions are not as given. Glucocorticoid deficiency was given or glucocorticoid deficiency? That means Addison's disease. How will you identify an Addisonian patient? he is that thin, emaciated, weight lost, hyperpigmented patient with a hypotension lying down on the side of the bed in the corner, and the nurse will tell, however I give IV fluids, the BP is not improving, doctor, it is only 80/60. And he is recurrently having that hypoglycemic attacks. If your nurse is telling, honking into your ear, still you didn't get an idea that he is Edison. You miss the game, right? So, weight loss, postural hypotension will be there, right? Edison is the problem in which gland? Adrenal. Autoimmune destruction of adrenal. If the adrenal is destroyed, can it produce mineralocorticoid? It cannot. That's the reason there is a development of hyperkalemia. Now, one important point you should not forget. How do you know that hypocortisolism is because of an adrenal problem or a pituitary problem? Pituitary, if it doesn't produce ACTH, hypopituitarism if it is there, then also adrenal get affected, no? Right? Adrenal produces two hormones. What are they? Glucocorticoid and mineralocorticoid. Adrenal depends on ACTH only for glucocorticoid production, not for mineralocorticoid. Even if ACTH is not produced by pituitary, still adrenal is capable of producing mineralocorticoids. If the mineralocorticoids are produced, will hyperkalemia will be there? If already mineralocorticoid is produced, why will there be hyperkalemia? It won't be there. So how do you differentiate hypocortisolism due to adrenal problem versus pituitary problem? I know. Please give me the board. You have a pituitary, doctor. You have an adrenal. Adrenal produce gluco and mineralo. It produces. For this, it gets inspiration from ACTH in the pituitary. If the adrenal is destroyed due to autoimmunity or TB, then both glucocorticoid and mineralocorticoid levels become decreased. If the mineralocorticoid is not there, what is the function of mineralocorticoid? Retention of sodium, loss of potassium into urine. If mineralocorticoid is not there, potassium is not lost into urine. So potassium is retained in the body, and that is the reason mineralocorticoid deficiency leads to hyperkalemia. Suppose if the problem is not because of the adrenal, but problem is with pituitary and ACTH is not produced, then what will happen? ACTH is needed only for glucocorticoid production, not for mineralocorticoid. Who decides the mineralocorticoid production by adrenal? Who tells adrenal to produce mineralocorticoid? Serum potassium levels will come and tell adrenal, please produce mineralocorticoid. Serum potassium only automatically will come and tell, see, I am becoming more and more in the body. Why is it all happening? Because mineralocorticoid is not throwing me into urine. So please adrenal produce mineralocorticoid, it will tell. Right? So that is the reason, if the hypocortisolism is due to the pituitary problem, then only glucocorticoid deficiency but no mineralocorticoid deficiency. Agreed? If hypocortisolism is due to adrenal problem, both glucocorticoid and mineralocorticoid. That is the reason hyperkalemia is a feature only when hypocortisolism is due to adrenal dysfunction but not due to pituitary dysfunction. Whereas glucocorticoid deficiency leading to hypoglycemia is there, na? That is a problem when hypocortisolism is either due to adrenal or pituitary. Got it? So presence of hyperkalemia points hypocortisolism is because of adrenal. If hyperkalemia not there, only glucocorticoid deficiency and hypoglycemia are there, means it points the problem to pituitary. Okay, so that is what you should remember. Now doctor, what is the gender specific side effect of valproate? What is your answer? Actually, weight gain is called gender specific. Females who are taking valproate only will pick up often this problem of weight gain more than the males. But examiner, did he give PCOD? Gave or not? Ovary will be there in the females only, not males. Then obviously that becomes the gender specific problem. This is too much, no? What, doctor? Yes or no? Why PCOD will occur? Whenever you gain weight and there is a insulin resistance, automatically that lead to PCOD. Weight gain is a part of PCOD, right? Whenever there is an excess amount of fat in weight gain, all that peripheral fat aromatized into estrogen, and that high estrogen will go and inhibit your FSH. If FSH is inhibited, then the ovum doesn't grow. That lead to polycystic ovarian disease. So that should be the answer, right? That means to get CT names, what you should know? Ovary is in female but not in male. If you know that, you will get. That means you didn't get CT names, means what did you not know? No, that is not the way to look at it. So, calcineurin inhibitor. One question, doctor. Immunosuppressive agents, without that there will be no paper. Tacrolimus, sicrolimus, mycophenolate mofetil, cyclosporin. Side effects, mechanism of action, बट्टी मार के जाना है एग्जाम को. आपके 200 पेजेस वाले नोटबुक में लिख के रखो. And if you don't correct even now, once more PGA you will do the same mistake. Hurry, you will be thinking, immunosuppressives, last exam I did wrong, this exam I did wrong. Next exam you will be going and anticipating to do wrong when JIPMER comes. So don't go into that phase. Okay, since you are all investing your time with us in the evening, our job is to tell you what to read. That's all. You have to read and prove it. Now doctor, vitamin B12 is necessary for everything, but not for the you have a methylmalonyl to acyl succinyl CoA, glutamate to methyl aspartate, glutamate mutase also you require. It's a question on vitamin B12 dependent enzymes, doctor. I am not sure what were the other options. Glucose 6 phosphatase is activated by what? Glucose 6 phosphatase is important for what? What is that condition where glucose 6 phosphatase deficiency occur? Von Guericke disease. So protein kinase A and cyclic AMP are the ones which stimulate the glucose 6 phosphatase, right? So that is what examiner is actually looking for. Cyclic AMP PKA signaling pathway is there, which will basically affect the glucose 6 phosphatase is the point of interest. Biotin has no role in which scenario? Gamma carboxylation of glutamate is because of vitamin K. Even a LKG MBBS student also will answer this. So it is no big deal. They are all gluconeogenic but not acetyl CoA. That's the reason acetyl CoA is called a ketone body. Right? Pyruvate, oxaloacetate, lactate. They all basically lead to the reformation of glucose. So, and one more favorite question examiner is going to ask in next exam. This is a very important table, doctor. What amino acids marne ke baad unke atma will enter into which of the citric acid cycle intermediates? Whose alanine, cysteine, glycine, serine, threonine, tryptophan, after their metabolism occur, these amino acids carbon skeletons will become pyruvate. Like that, each intermediate of the citric acid cycle, the atma of one of the mare hue amino acid will enter. And if you don't know that, your atma will not become unison with PG medical Paramatma. So be sure. So favorite question. What happens in HBS electrophoretic mobility? Typically a polar amino acid is replaced by a non-polar one. So obviously electrophoretic mobility is a property dependent on the polarity. That's the reason it will come slow in walking. One of the epigenetic phenomena, doctor, If you take the previous AIMS question bank, every time they will ask one epigenetic phenomena, all India AIMS. So methylation is the one which will cause the silencing of the genes. What is meant by genomic imprinting? If a particular gene, let us say the world's most beautiful female went to the most intelligent but ugly scientist and asked him, if we both marry, we will produce a child who is as beautiful or handsome like me and as brilliant like you. It is a great combination, let us marry. But he said that if he is born as dirty like me and as dumb like you, what are we going to do? That's how he is an intelligent guy. He proved that. Right? So, what is genomic imprinting? If the gene comes from the mother, then only it becomes expressed, not if it comes from father, if that allele. If that is there, that is called as maternal imprinting. Similarly, if it comes from the father only, if it gets expressed, paternal imprinting. So, if it doesn't come from father, but if it comes from mother, why it is becoming silent? Because there is a methylation of the DNA and make it silent DNA, which is called epigenetic phenomena, is what need to be remembered. Where does heme biosynthesis occur? Before going to exam only, what is our deal? One question on porphyrias and heme synthesis. Without that, there is no question paper. Every mock test we keep trying you to read porphyrias, and you also might have read it and gone for exam. So, part of the heme synthesis occur in the cytosol, part of it occur in mitochondria. Any cell which has a mitochondria is capable of producing heme. Does RBC has a mitochondria? No. So it cannot produce heme. Simple, right? So that's what examiner want to know. Selenocysteine codes for what? Basically UGA. Why so many genetic codes are there? See, your roommate will ask. I mean, your juniors will be preparing, no? क्या है अन्ना एक कोड पूछा ना, पूरा 64 कोड्स पढ़ के जाना है क्या? If you say yes, in coaching they said everything is important, come on, start reading. That fellow's life is liquidated. So be very sure, doctor. We would have been great but for our seniors who made us become little dumb. So be very sure. Why selenocysteine's genetic code was asked by examiner? UGA is basically what? Stop codon. There is a very intelligent way the things happen in our body. Suppose selenocysteine is required for the protein synthesis. That time automatically the cell will sense it and code it as selenocysteine. If it is not required, selenocysteine is not required in the protein chain, then if this UGA code comes, then it trigger it as a stop codon. So naturally our cells have got they studied biochemistry more than us, and accordingly wherever it need to be stopped they are stopping, otherwise if selenocysteine is required they are delivering, right? So that is a point. By boiled lobster syndrome, typically whenever boric acid intoxication is there, the skin looks like a boiled lobster. But how many of you know how lobster look like? Even if you know how the boiled appearance of it look like, that's the reason I brought a South Indian filter coffee with the boiled lobster. So can you see similarity between this boiled lobster and the hands of the patient? You should, at least now. That is the whole problem. एक आईपीसी के बिना होता क्या एग्जाम? उसको एम्स नहीं बोलते. कभी कभी 2-3 years back एम्स में 5 IPCs or 4 IPCs were given in same exam. You felt like committing suicide and writing a note. I love the for this state of me that it comes under which section of IPC you must know, suicide. So What is 193? Giving a fabricated evidence by a doctor is basically called as, and misleading the court is punishable offence for 7 years, is basically called the IPC 193. What is it? Yeah, any evidence given in the court of law is under oath only. Police have no authority to take evidence, no? In any stage of judicial proceeding. So police are part of judicial proceeding. I'm just now checking and trying to save myself. Then bomb blast injuries. What are the triad of features in bomb blast injuries? Abrasion, bruise and puncture, laceration. This is called the triad of bomb blast injuries. In chemical burn, you don't find singing of the hair. You find it in thermal burns but not corrosive burns. That's a point of interest. Shoe polish like smell. Fundamentally nitrobenzene. So bitter of almond smell and all those different smelling poisons, non-smelling poisons, you must be sure. What is Ashley's rule of sex determination? Based on the sternum length, he decided male or female. That is the brilliance of Ashley. What was that? Is for age or sex or what? Oh, but anyway, Ashley was there in the on board, no? That's important. 2 fracture lines on Peter's bone. How to identify first and second? First of all, why do you need to identify? Without a question on gunshot injury, right? Gunshot injury, there will be no question paper, na? So it is definitely a question on gunshot injuries. Whenever multiple shots are fired, which shot is the one which is fired first? You must know. Right, doctor? Especially in the scene of crime, you are watching so many crime movies, no? Evening hote hi star HD videos mein. So which is being fired first? So that is called puppy rule. What puppy said? Suppose if there are multiple perforation points, if you extend the line, suppose if it is extending, if the extension of the fracture line is stopping and if it is meeting the pre-existing fracture or suture line, then that is considered to be the second shot. Suppose if it is not meeting any other this thing, then that become the first shot. That is a puppy rule. Most common cause of the suicide according to National Crimes Bureau of 2014. Most common mode of suicide, yeah. You have very innovative imagination about how to die, right? So, okay, what is the most common mode of suicide among our medical group? Doing MD and planning to do DM. Right? So, that is most common mode. And after becoming DM, starting a nursing home and thinking of becoming a big man, they're all at least good, some nice suicidal ideations. Doctor, whatever you say, poisoning still is the most common mode according to the authority of India. They have, the Home Secretary has come up with one list, right? So now you know, if you read the park and you think you will get seat, will you get? बहुत मुश्किल है. You should read all Home Secretary, Finance Secretary, every secretary's reports on released in the recent budget, etc., etc. बहुत लंबा preparation है. इसलिए don't say I didn't cover that, I didn't cover this. You check whether you covered yourself or not. Always without being covered something or other only we will go to exam. Be very sure. So, in this, doctor, alcoholism, drowning, etc. are the things. Poisoning is 29.1%. Highest. Oh, sorry. Hanging is I didn't see, doctor. Actually, till morning 5 o'clock I was preparing like a hot dosha to serve you when you come in the evening. Oh, hanging is 37 is there? Hanging 41. So hanging scores highest. So good. Hanging is the most common, right? Was this question there? Gram-positive coccus. Picture was there. This question I was also suspecting whether there or not, because they can't give such a simple question. Antibody dependent enhancement is seen in, typically in the case of the dengue fever. What is meaning of antibody dependent enhancement? Whenever a non-neutralizing antiviral protein is being produced, our body obviously, whenever a viral infection is there, it will produce an antiviral protein. Right, doctor? That antiviral protein itself will facilitate the entry of the virus into host cell. मतलब आपने एक सिक्योरिटी गार्ड को लगाया, घर में चोर आएगा बोल के, आप वेकेशन पे गए, तो सिक्योरिटी गार्ड कॉल्ड the thief and gave him information and facilitated him. शरबत पीते क्या, आइए आप जल्दी में चोरी करने की जरूरत नहीं, स्लोली करो क्योंकि साहब वेकेशन से आने के लिए बहुत टाइम लगेगा. तो like that, when a non-neutralizing antiviral protein is being produced in our body against the virus, that will facilitate the entry of the virus into the host cell. That is the phenomena which you see in dengue fever, which is called antibody dependent enhancement. See how to answer this question, I will tell you. Don't tell others. The Dr. Murali Bharadwaj teach like this. Anyway, you know dengue fever is the most epidemic, high yield topic. Examiner is asking means, what his intention is? That you should answer dengue. Right? So, there is a simple common sense. If tuberculosis is there in options, what is the answer? Tuberculosis. If apoptosis is there in the answers, that's the reason. खाली high yield topic list क्या है पढ़ के जाओ, seat मिल जाएगा. Young lady presented with dyspnea with lobectomy done and histopathology shown, and she was having Paragonimus westermaniae in one layer. ये तो MBBS वाला level वाला question नहीं है. पहला Paragonimus westermaniae is called lung fluke. To know that itself is a big deal. Huh? Picture, how can it be this one? I am not the examiner. No, Paragonimus was there, no, in the options. Huh? Lung fluke was also there in the options. That's what. Something. But histopathology was given or not? It's a picture based question only, no? 2 layers were there in that. Oh, ये भी दिक्कत है. अच्छा, okay. Anyway, I'm not sure on what image examiner wanted. One question on hepatitis B serology, without that there is no paper, doctor. अभी फटाफट बोलो, hepatitis B surface antigen negative was there or not? There, right? Immunoglobulin G, HBC, AG was there or not? There, right? Then anti-HBs AG was there or not? But it is negative बोल के दिया क्या? Anti-HBs AG negative बोल के दिया क्या? No, that's called recall bias of a case control trial. You are trying to recall. No, why बोले तो I will tell you. If the hepatitis B IgG antibody is there, positive, there are only 4 scenarios, doctor. Resolved acute infection, chronic carrier state, chronic active hepatitis, or chronic active hepatitis with a pre-core mutant. Was there or not? Now, I am coming to the point. But if the hepatitis B surface antigen is negative, the only scenario where you have where IgG is positive and hepatitis B surface antigen being negative is what? A acute infection which has got resolved. But in that hepatitis B surface antibody should be there. But was it there or not? Not there. So the only scenario where surface antibody is not there and surface antigen is also not there. सास भी नहीं आए, बहू भी नहीं आए. अगर hepatitis B antibody आ गए तो surface antigen will go away. If both are not there, that is the only scenario where you find it in window period. But window period mein you will not have a core IgG positive. IgG antibody won't be positive in a window period. That is the tension. Okay. But anyway, there can be gross error of commission and omission of looking at the question. But have you gone to exam prepared for a serological antibody of the hepatitis B question expected to come or not? Before going to exam, if you didn't go, at least now you go. Definitely one question on hepatitis B serology. Without that, there is no paper, right? So you need to be 100% sure on this table. Any permutation combination can come. It is very much there in Davidson, Harrison, every son. Now, what is the most effective way to prevent? So, this is one more question where you don't need preparation. Then what is the mode of acquiring this? So what is this? This is basically the Trichuris trichura with POM. So Trichuris trichura, X will contaminate the soil and that contaminated soil will contaminate the vegetables and that contaminate the eatables, which can be vegetarian or non-vegetarian whenever the person eats. That is how we acquire. But were the vegetables were given or not? Not by contaminated water. Feco-oral route was given. That becomes the answer. Then female with pruritus with vaginal discharge with Klucel. Still, if you didn't jump and answer it as Gardnerella, what is that? Yeah, it's a part of the clinical. Pruritus was there. Oh, pruritus was there, but still Klucel was given. Better we depend on Klucel and forget the itch. Something we should do. Yeah. What is the larva? Basically Brugia, Malayi, and there are ways of remembering it, knowing it. Ye be sheer luck of answering only. Our microbiology days only we have not seen what is the lepra bacillus. Forget about Brugia Malayi. Right? Lepra bacillus we have not seen. Tubercle bacillus AFB experiment day, that day only first time we went for dating. So we didn't have time to go to lab to do all that Neil Gielsen stain. So what is a gram-positive organism with a branching pattern? Nocardia. Right? In the bronchial wash, Nocardia is partial acid-fast staining organism. What is the stain used for? Actinomycetes. Actinomycetes is an example of an acid-fast stain. Recently we discussed microbiology, doctor, DNB question bank, last 15 years. Ek body, what body? Inclusion body. cytoplasmic, nuclear, Cowdry A, Cowdry B, blah blah blah, different bodies, and one stain will definitely come in entrance, right? So that is the simple stain. But next exam in PGI, what are they going to ask? What are all the typical uses of the parasites which are acid fast positive? I mean acid fast. Cryptosporidium, Isospora bellii, Cyclospora. They are all basically considered to be acid fast is what you need to remember. Athletic male with a groin lesion which is called Dobie's itch. Same question we had it in one of our mock tests, dermatophyte infection. Then, all except, correct. Aspergillus is not involved. It is a dermatophyte infection. Lady with buccal reticulate white streaks. You need not know the answer also. Lichen planus anyway is the high yield topic. One question definitely come now, Wickham striae, etc. etc. So that is the reason the reticulate pattern of the Wickham striae you should remember. Very easy question. Oral candidiasis with white patch is seen in all but not in atrophic. Atrophic is also what the other name given? Typically it is also called erythromatous candidiasis is the name which is being given. Erythromatous candidiasis is the name given for atrophic. Or red rehta, white nahi rehta. So that is the point about the candidiasis, atrophic candidiasis. There are three varieties, doctor: hyperplastic candidiasis, atrophic candidiasis, and pseudomembranous candidiasis. This is an example of pseudomembranous which is white in color, and atrophic which is erythematous will not be white in color. So that is a point. Neurocystic causes developed peeling of the skin starting 1 month after taking medication. Generally, if it is a fixed drug eruption, when will it start? Within 1 week. Palms and hands are first to be involved. Whereas 10 and SJS, Steven Johnson and toxic epidermal necrolysis, they don't involve. They won't, they are less common to involve the hands and palms. Then is it 10 or SJS then? 10 is more than 30%, SJS is less than, and carbamazepine is known to lead to Steven Johnson classically. So what is this kit with white and brown separate tablets? They gave whole body. Souls are spared was there. I mean, based on the frame of the question, decide on what was 10 or SJS. What is that kit? Typically, it is a leprosy treatment kit. Fairly small nodules on the forehead. Many times we had that umbilicated lesions of molluscum contagiosum. Nodulocystic acne, how do you basically treat? Topical treatment will not do well for the nodulocystic acne. You have to use systemic therapy in the form of oral isotretinoin is considered to be the management. 18-year-old with vitiligo involving the both lower limbs. What is the treatment that you basically give? You give clobetasol, tacrolimus, methoxysorelin. And that's what, except tretinoin. Tretinoin is not given, all the remaining three are indicated. Clobetasol, tacrolimus, and also methoxysorelin also is given for the vitiligo. Okay. But don't worry, vitiligo treatment is too far a stretch of imagination. But that Wickham striae wala question hai na, that you should, 10 wala question, you should, what were the other questions? They're all standard questions, supposed to answer. Once more, that candidiasis can be a bouncer, because nobody will read which is a white candidiasis, which is red, which is brown, which is blue. But still you won't lose entrance by not answering that candida wala question or vitiligo wala question. If you don't answer lichen planus wala question, garbad ho jayega. So that you should not do wrong. 18-year-old anesthetic patch histopathology is typically showing the presence of the leprobacilli. So it is a case of tuberculoid type of leprosy. Last time in DNB 15-year question bank in dermatology discussion, we discussed about how to differentiate TT, LL, etc. the various lesions. Even in DNB also it's a very favorite question. You will find more or less the cousins of the same topics in the forthcoming DNB, right? So this is how a typical tuberculoid leprosy lesions can look like. Now female with genital ulcer, and there was a school of fish like appearance, which is Haemophilus ducreyi. Is it painful or painless? Huh? Ducreyi, do I cry? So it is painful, whereas syphilitic chancre is painless and hard, is what need to be remembered. Diarrhea in adult who ate shellfish classically will be Norwalk virus, which belong to calcivirus family. Noro, was it given or not? Yes. But Norwalk was not given, no? Norwalk belonged to calci. I thought Noro is by mistake somebody wrote and corrected it to Norwalk. Suddenly Norwalk virus, which belongs to calcivirus bolke Google is saying. Then I thought, oh, maybe Noro was correct only and calci is the correct answer. Norwalk is most common cause in shellfish ingestion, and it belongs to calcivirus. So this is the typical shellfish. Vibrio parahemolyticus is another important infection which lead to fulminant infection, also shellfish, you should remember. Trivalent flu does not contain H2N1, it contains H1N1, H3N2, influenza B. H1N1, H3N2 are influenza A viral congeners. So what is the important point you realized? When you go for tomorrow DNB exam, एक flu wala question. Because there are lot of epidemics, pandemics, etc. happening, influenza. So swine flu, avian flu, pig flu, donkey flu, all flus. You must be ready and expect examiner to give one question. Then best site for core body temperature measurement. Upper third was given or distal third? सोच के बताओ. Then there is no answer. Because all these four are called core sites for temperature. You thought nasopharynx is not core part of the body, huh? What else was there? Intraoperatively, yeah, even for core temperature monitoring is basically done to monitor the intraoperative hypothermia only. All the four are there. I don't know what examiner exactly is looking for. Just I cooked it as upper third. Huh? So, yeah. How do you measure anatomical dead space? Anatomical dead space. Single breath nitrogen test. Okay. So, we used to have one pulmonologist. By profession he is a pulmonologist, but he is a chain smoker. So whenever we used to say, what is this paradox? You are a pulmonologist and you are a chain smoker. Yeah, this is an example of my spirometric analysis. Can I smoke 5 cigarettes means my lungs are working well. He used to auto test it. So single breath nitrogen test is for dead space. Rashtriya Swasthya Bima Yojana. Last time in DNB discussion only we said Janani Suraksha Yojana, Kishori Bhalai Yojana, right? And Lady Doctors on Duty Suraksha Yojana. You will have lot of schemes, and one scheme wala question aayega, right? He can get treated in any empaneled, if there is that smart card and fingerprint. If that is there, they can go to any private or government. Anyway, they won't go to government with a smart card, they will go to private and cashless treatment. To whom will they do that? Below poverty line. If 2 years you sat for preparation, still didn't get a seat, you can apply for Rashtriya Doctor Swasthya Bima Yojana. So be very sure, and they are entitled for a hospitalization up to 30,000 coverage. आजकल registration fee in hospital only is 30,000. अगर कुछ दिक्कत हो गए तो फर्स्ट 30,000 पे करो, बाद में सोचेंगे क्या है आपका प्रॉब्लम बोल रहे लोग. 30,000 कहां चलेगा डॉक्टर? Then 5 members are given. The head of the household, spouse and up to 3 dependents. Examiner gave 2 dependents, which is except. Which is not applicable. Malaria 2013. Earlier they used to give presumptive treatment. किसी को बुखार है तो मुंह में एक क्लोरोक्विन डालो, वो अभी बंद कर दिया. क्यों? बहुत लोग मुंह खोलने के लिए तैयार नहीं है. They are not opening their mouths for your chloroquine, whatever be the cause of fever. Right? So, primaquine is contraindicated in infants and pregnant is the recommendation. Then doctor, if they are positive for Vivax, falciparum, mixed infection, what is the typical drugs that you need to give? What duration? Primaquine should be given for 14 days, not 7 days. That is the reason this option, it should be given for 7 days became wrong. Chloroquine for 3 days, primaquine for 14 days, not 7 days. So please go through this table. Definitely one more question will come from the malaria recommendations. Okay, doctor? Recently delivered mom before 15 days with a sick neonate. Janani Sishu Suraksha Yojana is the one. Definitely next exam they will ask on IMNCA. नहीं तो आशा मिलेगा. What is the function of Asha? What will she do? Is she a gazetted officer? Will she give formal education? Will she also give coaching for MD entrance? All these questions they will ask. आशा आंगनवाड़ी वर्कर अगर आप पक्का नहीं है तो you need to end up in SPM only. So be sure, doctor. 2 questions came. What is the best method to know the strength of association? Cohort or case control? Case control में you will know through odds ratio. Cohort में you will calculate the attributable risk and then get a strength of association. You want to say that? I didn't think about this angle of the question. We will ask the Pandits in SPM what exactly they want to know. एक दूध वाला क्वेश्चन. Cow milk, breast milk, buffalo milk, goat milk. Which will have how many calories? Which will have how much iron? Buffalo's milk is for buffalo's baby. Breast milk is for human baby. So you must know the table, hai na? So what is deficient? Iron, vitamin C. Then doctor, for knowing the hearing in neonates, see there are 2 things. Photoacoustic emissions, second is auditory brain evoked response audiometry. Right? BERA. What is the difference between BERA and otoacoustic emissions? From where are the otoacoustic emissions coming from? Inner ear. So otoacoustic emissions can only detect until the inner ear problem. They can't detect above that. Right? Whereas your auditory brainstem response can detect up to the level of the brainstem. Right? Generally for screening we use otoacoustic emissions which are automated. Suppose if they turn abnormal, then we will go for auditory brainstem response. That is the point you need to remember in the in-hospitalized patient. Otherwise both of them are used. Okay. In both ears AC more than BC. Rini negative or positive then? What do you call it as? Positive. That means conductive deafness there or not? Not. So what is possibility? Sensorineural deafness. And the Weber is lateralized to right. So which side is sensory? So that is the reason. What is your ultimate diagnosis? Left side sensorineural deafness. How will you prove that? By doing Schwab-X test. If you do Schwab-X test, what do you get? Schwab-X test. If the conduction is shortened, absolute bone conduction, that is sensorineural. If ABC is elongated, then that is conductive deafness. कितने लोग को समझ में नहीं आए? How many didn't follow? Please be honest. AC more than BC means normal. I mean, Rinne's test positive or negative? Rinne's positive is normal or abnormal? Normal, or it can be sensorineural deafness also, but not conductive deafness. Lateralization, which side it will occur? Weber, if you put centrally a tuning fork, which side you will listen more? Better ear or a bad ear? Better ear. So it is heard best in right ear. So where is the problem? Left ear. If it is left ear, what is another proof to say that it is a left ear one? You will do Schwabach. What do you do in Schwabach? You will ting tuning fork, put on the side of the patient's ear, and patient will say, ah, yeah, ruk gaya. Then you will put and listen whether you can listen or not. Assuming that you have a good ear. That is the pitfall. Schwabach's test. But once more, Rinne, Weber, Schwabach, कोई एग्जाम रहता इसके बिना? जरूर रहे. They will definitely come in exam. Top 20 topics. 10 hours में खत्म करना ENT preparation. If you know what are the 20 topics, definitely out of which 90% questions are going to come, you go for exam. Don't read all that 40-50 topics and think yourself as an ideal student. Ideal don't exist, right? So आपका टाइम टेबल बड़ा है तो डिप्रेशन भी बड़ा होते. Ideally you should aim little, sure to come, strong to answer, go to exam anticipating 80%. What you anticipated will come 20%. Leave it to God to give you brevity of discretion. Now doctor, ossicles, what is the congenital anomaly? अगर कोई स्टूडेंट आंसर कर सकता क्या? अगर ENT में गोल्ड मेडल आए तो भी there is a big list of abnormalities of the inner ear. To know that inner ear will have congenital anomalies itself is a big deal. First of all, inner ear is different from middle ear. Knowing also is a little challenge. On the top of it, which is most common, this is unexpected pregnancy. And in spite of all contraceptive efforts, you prepared very well and went to exam to tear it out. Finally, you discovered that you are torn. So, this is unexpected, so don't worry. 38.5% is incus and malleus fixation is the most common abnormality out of the various common, among the various congenital anomalies of the ear. That's the point you need to know. Chronic alcoholic clay stools imaging shows both dilated CBD and pancreatic duct. What is that sign called as? Double ductal sign, which is seen in the case of the carcinoma of the head of the pancreas in the ampullary area, is what you need to remember. 30-year-old endoscopic biopsy was showing Barrett's esophagus. So that is the reason it is a Barrett's. That's the reason check for the dysplastic changes to know whether there is any precancerous change. Then doctor, Meckel's diverticulum, rule of 2. Without knowing that, you can't aim for the second rank. So 2% population, 2% symptomatic, 2 inches long, all that rule of 2, blah blah blah, and 10% rule of what? Pheochromocytoma, you should definitely know. Glasgow minimum is 3, maximum is 15. Even if you are a topper, Glasgow maximum is 15 only, not 18. So be very sure. Then doctor, Thyroid storm, why does it occur? See, earlier days, improper preparation was the cause. But nowadays, pre-operatively, we are giving to radio-iodine and controlling it properly. Even if you don't control also, patient will come with a Google web page and ask you, sir, why you are not controlling me and why are you operating? Right? So, we are controlling. So, that is not the most common cause now. Now, the most common cause is sepsis or intercurrent illness. So, any fever is a precipitating factor in the modern time. Fever was not there, sepsis was there, intercurrent illness is not there. Then your improper pre-operative preparation was there, then that is the answer. If it is there, fine. See, you tell me the answer what you want, I will substantiate it. Last 15 years we are not doing anything, any other work after MD General Medicine. Even if when we see patients also we talk about caloric values, etc., etc. I mean, we are a special kind of physician plus teacher. So that's the reason, we can substantiate anything. What ligament where you get that giving up sensation for the first time when you are doing LP? How many of you have not done LP? Sorry, that is not the way to ask. How many have done LP? Okay, that's an easy way of. If you don't do LP in housemanship, if you have not done the venesection, you have not done endotracheal intubation, if you didn't get that giving up feeling, oh doctor, you missed that housemanship orgasm. What else you are doing? You are all sitting in reading rooms and hours reading. No doctor, you should get that. So why that initial giving up will come? Let us see. Fundamentally, whenever you are passing, you have a supraspinatus ligament, interspinatus ligament, interspinous ligament, and ultimately you are having a ligamentum flavum. Whenever the needle is passing to the ligamentum flavum, first giving will come. Then whenever it is piercing dura, second giving, popping up feeling will come. Then you will pass the needle into where? Which space? Come on. This is there. Subarachnoid space. Then is the audio okay? Yeah. So that is what you need to remember. So what is the answer? Ligamentum flavum is the first resistance of that pop-up, which you need to basically remember. So this is the typical picture where you are piercing into the ligamentum flavum while entering, and next you will pierce the dura. Okay. Then doctor, rhinitis not subsiding, lung problems, kidney problems, what is the diagnosis? Was it the same way they asked? Huh? Oh, this is a common patient's language, doctor. On telephone he will tell you. That ENT doctor checked me, doctor. He said that sinus surgery I should undergo. After that, the TB doctor checked and said that you are having blood in sputum, so start TB drugs. Recently, kidney doctor has seen me and said that there is blood in your urine, you are going to die. You are the one who should listen. Upper respiratory, lower respiratory, kidney means which vasculitis? Vaginous granulomatosis, which is ANCA related, is what you have to basically remember. But otherwise also you can answer this as ANCA vasculitis, because one vasculitis question expected to come. Types of cryoglobulonemias. Every Sunday mock test and Wednesday mock test, we will equip you with common topics going to come in exam. Huh? Why not TB? Huh? Why not TB, right? Yeah, but general rule is TB. If TB is in the options, TB should be answered, no? Sometimes rules fail. Huh? That is the most important rule. Now, doctor, but TB was there in the options. Examiners must be taught how to frame questions. Now doctor, fibrosis mein curve will be low, emphysema mein overinflated lungs curve will be high. So that low curve was given. Next exam mein emphysema curve will be given. Microalbuminuria, you cannot detect it with a routine urinary test, is a very important carry home message of this question. Then what differentiates tamponade from tension pneumothorax? Tension pneumothorax mein lung sounds will be not heard. Tamponade mein only heart sounds will not be heard. That's also right. Cardiac tamponade mein, because of all that fluid, they become muffled. Good. Now doctor, athlete died. If athlete dies, what are the only two reasons he will die? MVP or HOCM? Athlete dies only unless you jumped and clicked on HOCM. If you don't do that, death will not come that easy for you. That is called as spinal cord level answering in the exam hall. Your chordae equina, like what is that movie day before yesterday I was watching. Avatar. Like the tail, it will be looking where is the answer. Like that in Avatar movie you have seen, no? So like that, not Dashavatar, Avatar. Like that you should answer a tail level like a Mars planet species in the exam hall. HOCM, what else? What is not specific for iron metabolism? DMTA. What is the name given for the DMTA? It is a divalent metal associated. So, cadmium, copper, zinc, iron, for everything it is a common Draupadi. So, it is not specific anymore for only iron is what you need to remember. Benign intracranial hypertension mein you don't have proptosis. I think easiest question in the world. Then early morning backache stiffness means what is the ankylosing spondylitis. So they will develop a restrictive lung disease is what you have to basically remember. 46-year-old ECG was given and it was showing the MI. But already 1 day is over by the time he came to you. Within 6 hours if you give thrombolysis, most effective. After 1 day also you want to give thrombolysis means only you are planning to get him one bleed in the brain also, so that he will get a stroke and your wife neurologist can take care of him, because she is not having a very good business. So be very sure. What is a common cause of fungal eye infection was given or endophthalmitis was given? Fungal eye infection. So actually most common endophthalmitis is candida. So I hope that examiner want to check that fact only. Which conjugate is shortest, doctor? Oxidic conjugate is shortest, and true conjugate is also called as anatomical conjugate is the other name given for true conjugate. Progesterone estrogen who will produce after ovulation? Corpus luteum will produce. Beaded fallopian tube. Here if TB is in the options, TB is the answer. So genital TB. Remember doctor, pipe stem tube, cobblestone tube, leopard skin tube. These are all the things which are applicable for the TB of the fallopian tube. Because you know that the only infection that comes to tube is TB. Right? So let us see. What is this called as? It looks like a golf hole. Golf hole. Golf hole, golf club. Then what is this called? Beaded appearance on histosalpingogram. मैं आपको ये क्यों दिखा रहे हूं बोले तो next exam में they will give image. They are going to give image. You must be ready for any image, doctor. सर्जरी दास के पीछे इमेजेस है ना, गाइनॉक्स के पीछे इमेजेस है, फोर्सेप्स, नीडल्स, सूचर्स, वेलसेलम्स, rotating ones, Clelands, Pipers, any of the instrument can come. Be ready. Hope I am not scaring you. Because even in our state MD entrance in AP also they gave about 55 or 60 questions. Right? That means all examiners are planning same thing to attack us. Then what is this called as? pipe stem like fallopian tube. And what is this called as? Floral appearance के जैसे है fallopian tube. Once more TB. And this is called as cobblestoning of the fallopian tube. Once more a consequence of TB is what you need to remember. When you should give folic acid prophylaxis? Before conception only you should start. Because lot of people don't know when they conceived unless you told them. Obviously, no doctor. 7-8 weeks time they will take to recognize that they are in the process of conception. So, if they are not taking folate, already first 8 weeks may there is embryogenesis occurring, no? Now, pregnant woman at 18 weeks, child born with thalassemia previously, at 18th week the only thing that you know to do is amniocentesis is the best way by which you can be able to identify. How is recognized menopause? FSH more than 40 is the typical benchmark. Audio and video are out of sync.